Yes, this is a real thing. If you are going to sleep at variable bedtimes, especially if you go to sleep much later than your usual habitual bedtime, you will miss that growth hormone pulse that normally occurs in the first 2 to 3 hours of sleep. This does not mean that you need to be neurotic about getting to sleep at the exact same time every night. There's probably a plus or minus 30-minute window. And it doesn't mean that you can't stay out late or have a bad night's sleep every once in a while, or get woken up. Your hair isn't going to fall out. That story notwithstanding, your hair isn't going to all fall out because of that. But you do want to try and get that natural growth hormone release each night. And as I mentioned, there are prescription approaches, and those are growth hormone itself and things like sermorelin, which is a peptide that increases growth hormone. It's actually a secretagogue. It causes the secretion of growth hormone and thereby increases in IGF-1. This is well documented. Both growth hormone and IGF-1, I mentioned, are available by prescription. They are not without their side effects. So they do cause growth of all tissues. They do increase height in children. They increase bone mass and density. They can increase mainly fat loss, not so much muscle size, but they can increase leanness, and they increase hair growth. They can increase turnover of skin. They can make skin look more youthful. All these things sound wonderful, and yet they also have problems because they can increase growth of small tumors that normally might be eliminated. So there is an increased cancer risk with growth hormone treatments and IGF-1 or anything that increases IGF-1, such as sermorelin, ipamorelin, any of the peptides that you hear about nowadays. That said, a number of people are using sermorelin as an indirect way to increase IGF-1 and thereby to increase hair growth. It does seem to be fairly effective in doing that, especially when done in conjunction with other treatments that we'll talk about. But keep in mind, these are prescription drugs and they do carry their own risks.